You are now watching Evidence-Based Projects. Alongside Anita Goodpiping, I'm Buster Cheeks Out. Our testimonial correspondent Dixon Sider will join us shortly. How are we feeling, Anita?
Not too bad. Just waiting for that second gummy to kick in. How's life treating you?
Like a baby treats his diaper. Moving on. Tonight, we will be discussing osteoarthritis. The definition, pathogenesis, signs, and symptoms.
In addition, we will address some contributing factors, interventions and modalities, as well as check in with our testimonial correspondent, Dixon Sider, who will be interviewing student and guitarist for the Panty Droppers, Christopher P. Smith, on why he chose this topic.
Osteoarthritis, OA, is a degenerative joint disease and, as such, does not fall into the same classification as rheumatoid arthritis, which is true inflammatory arthritis. OA can occur in any age group, although because it is largely a degenerative process due to wear and tear on the joints, most cases occur in people over 45 years old, and the incidence increases with age. Typically, under age 55, more men than women have OA, but this reverses after age 55. Two types of OA exist, primary and secondary. The etiology of primary OA is unknown. However, secondary OA is the result of known factors such as previous injury to the joint, previous infection in the joint, a history of hypermobile joints, repetitive stress because of occupation, sports, or hobbies, obesity, hemophilia with bleeding into the joint, or hyperthyroidism. Repetitive stress injuries can occur from playing sports such as tennis, which may cause OA to develop in the shoulder, and soccer, which may cause knee injuries that predispose people to OA of the knee.
What are some of the signs and symptoms? Pathologically, OA is a non-inflammatory condition that is usually gradual and progressively degenerative. The condition can interfere with functional activities depending on the location of the joint involved. The characteristic signs and symptoms of OA include damage to the hyaline cartilage in the preliminary stages. The mechanism of cartilage damage is through splitting of the collagen fibers and disorganization of the proteoglycans, causing the cartilage to absorb water. The absorption of water by the cartilage causes cracks to develop in the surface of the cartilage, known as fibrillation, much like a chick emerging from an egg cracking the surface by pushing from within. These cracks join, and pieces of cartilage flake off into the joint space. The pieces of loose cartilage can cause locking and discomfort if they become trapped in the joint line and may result in reduced range of motion of the joint. The synovial fluid will eventually absorb the cartilage pieces. The hyaline cartilage gradually becomes thinner and thinner until there is no cartilage remaining. The bone beneath the cartilage becomes shiny and smooth due to rubbing of bone against bone, causing eburnation of the bone ends. The bone ends change shape due to the degenerative process with a flattening of the femoral head in the hip and the tibial condyles in the knee.
People with OA experience pain while weight-bearing, caused by synovial membrane nipping and hypertrophy, and bone pain because of the rubbing together of bone ends. Night pain may also occur after extensive activity, as well as pain after exercise. Stiffness after inactivity that improves with movement. Reduced range of motion caused by muscle spasms, contractures, or bony blockage. Muscle atrophy, weakness, and spasms because of disuse and overstretching of the muscles. Joint deformity and enlargement. Joint crepitus, a grating noise within the joint because of bone rubbing on bone or cartilage disintegration. Reduced function or loss of function due to pain and muscle weakness. Obesity remains the most important risk factor for the incidence and progression of osteoarthritis. The leading cause of OA was believed to be overloading the joints due to excess weight, which in turn leads to the destruction of articular cartilage. However, recent studies have proved otherwise. There are various other factors that may lead to the initiation and progression of obesity-associated OA.
Outside of overeating, there are 3 main contributing factors to weight gain that you may not be aware of. They are 1. Your insulin levels may be out of order.
Insulin is the hormone that signals the body to pull glucose from the bloodstream and store it in the muscles, liver, and fat. But when you're overweight, your cells may not respond to the insulin as well. They're resistant. So the pancreas has to pump out more insulin to maintain a normal blood sugar. High insulin levels keep the body in storage mode and make weight loss more difficult.
2. Stress and exhaustion are slowing your metabolism.
I see this all the time. You may not step on the scale for a while, and you feel like you haven't changed anything, and all of a sudden you go to the doctor's office and notice you've gained 10 or 20 pounds. If you are up at night worrying about your final exams, social media posts that have gotten under your skin, or having your favorite news channel bombarding you with negative news, understand this: stress and lack of sleep can cause a cascade of hormonal changes that alter your metabolism and affect your sense of hunger and fullness. Stress pumps up the hormones ghrelin and cortisol, which increase your appetite and can make you crave carbs, while dialing down the hormone leptin, which helps you feel full. Stress also hinders sleep, which further throws off metabolism rates and hunger cues.
3. Your allergy pills may be making you fat.
We're not 100% sure why, but it's believed that histamines, the chemicals produced by your immune system to fight allergens, have a role in appetite control. That means antihistamines may cause you to eat more.
But don't take the word of two AI-generated news reporters and evidence-based articles provided by resources through Kennebec Valley Community College. At this time, we check in with our testimonial correspondent, Dixon Sider. How are you doing, Dixon?
Not so good, Buster. I'm hungover and I found my girlfriend in bed with another man.
That's terrible.
No, it's fine now. Although my side chick is acting a little funny. Can you believe she made me sleep on the couch?
I can hardly wait for the next Christmas party at the Sider household. Ready to move on now that you've gotten that off your chest?
We'll see. He is a guitarist and vocalist, alongside Jack Jowett, Sam Worthley, and Noah Brooks, who make up the acoustic quartet, the Panty Droppers, and will be appearing at local fundraisers in upcoming semesters. He is also a student physical therapist assistant at KVCC, and based on his demographic, he is an ideal candidate for osteoarthritis. Today, I'm here with Christopher P. Smith. How are you doing today?
Apparently, not as bad as you.
You, man. I mean your physical health. Tell us about yourself.
I am a physical therapist assistant student at Kennebec Valley Community College, and I turned 53 years old on April 19, 2024.
Tell us about your upbringing.
Growing up, part of my physical activity was walking everywhere, every day, because we were without a car. Even with taking public transportation, there was still a measure of walking once the bus stopped. Sure, my grandmother drove us places occasionally, but it was rare. My mother did not have a driver's license until I taught her to drive after receiving mine.
Did you play any sports growing up?
I played football, basketball, and participated in several track events in high school. Even once I started driving, I still walked often because of lack of money for gas. Living in a large city, it was sometimes easier to take a bus or walk to places. Once I moved to more rural areas in Maine, my walking lessened, and sitting in front of a computer monitor and on phones for work became more frequent.
Did you remain active as you got older?
Up until I was in my early 30s, I still managed to remain active between softball leagues and open court basketball. Now, because of school, both in class and at home studying, I have been a part of a more sedentary lifestyle. When I graduated from high school, I was about 185 pounds. As of today, I weigh over 250 pounds.
Tell us about your experience playing basketball after a long absence.
The first time we went to Alphonse Center in my second semester was the first time in years that I had played any type of competitive basketball. My left knee had ached for at least a week after, and I know that weight gain is a large part of it. I spent the better part of 2 weeks hobbling around. I chose this course to research different techniques to maintain a healthy lifestyle through newer ways of critical thinking away from what had been taught. A huge part of that was dietary habits, but I will not be going into much detail about that. I had been waking up most mornings with stiffness and pain in my lower back and hips for several months. Although it was never diagnosed professionally, I believe it to be the beginning of osteoarthritis based on the symptoms and what we have learned in class. This is why I chose this subject.
Did you take any prescribed medications?
I have seen other people, regarding back pain, turn to antidepressants and other painkillers. The results that I observed were like the findings of this study. There were intervals of temporary relief, but getting up and moving worked a lot better. With the antidepressants, I also noticed significant weight gain and lack of motivation. The medication was just putting a bandage over a bullet hole. It was more psychological than physical.
Thanks, Chris. Back to you in the studio, Anita and Basta.
Thank you, Dixon and Christopher, for that testimony. It proved to be highly informative. We will return to evidence-based projects after a word from our sponsors.
I remember it like it was yesterday. I checked my bank account, and what started as a reduction in my allowance began a dreadful downward spiral. I had it all. An 11-bedroom, 8-bathroom estate. Tennis courts. A tranquil waterfall leading to a private pool. 12-car garage. I had to move into this 5-bedroom, 3-bathroom servant shack. No wine cellar. No private pool. Not even a place to park my yacht or helicopter. Just some cheap beer-filled urinary tract infection called a lake. I even had to resort to going into public and purchasing my own groceries like some peasant or welfare recipient. I am H. Barnaby Whipplethorpe III, founder of WAPM, the White and Privileged Male Support Group. I knew there were others with similar struggles and needed a safe space to discuss these difficulties that plague society.
And I had to trade in my Rolls-Royce for a Mercedes, an E-Class.
The WAPM Support Group is such a place where we can discuss our profiles in heroism in an open, non-judgmental forum. To locate or form a chapter close to you, dial 1-888-RICHWYT, and a privileged specialty agent will assist you. WAPM, because everyone needs a safe space.
And now, back to evidence-based projects where we were discussing osteoarthritis. Here are some interventions for reducing the effects of OA. Exercise every day using the specific home exercise program provided by the PT or PTA. Here are some exercises to help combat the effects of OA. Adductors, abductors, knee raises, calf raises, hip extensions. Try to walk as much as possible to maintain aerobic capacity, mobilize stiff joints, and strengthen muscles. In addition, try to pace activity too little and often, rather than too much at once. Use a cane to prevent a limp. A limp could place stress on other joints. Avoid keeping the joint in any one position for extended periods of time. If forced to be in a sitting position, try to perform isometric exercises and gentle range of motion exercises as frequently as possible. Avoid prolonged standing in one position. Do not place a pillow beneath your knees. Using a pillow will encourage knee and hip flexion deformities. Know your limits. Do not lift heavy weights that will place extra stress on your joints. Keep your joints warm whenever possible. Chilly weather can aggravate the pain of OA. Use a moist heating pad at home for pain control. If the knees swell, elevate the legs for 15 minutes, 3 times a day. Try to avoid sitting for prolonged periods, which encourages flexion deformities of the hip and knee. Avoid crossing the legs, which will impair circulation. Follow the physician's prescription for medications.
Now, here are some modalities and treatments that can be used to treat OA. The agitation creates the whirlpool effect, which can provide benefits in conditions such as sprains, contractures, post-surgical repair of joints and soft tissues, healing fractures, osteoarthritis, and rheumatoid arthritis. Ultrasound may be helpful for patients with OA and rheumatoid arthritis. It was found to be effective in improving function and pain in patients with knee OA. Therapeutic ultrasound has been hypothesized to increase chondrocyte production in the knee. Hand ultrasound is effective in improving grip strength, reducing pain, increasing wrist flexion strength, and decreasing morning stiffness and joint swelling. Another effective pain management tool for OA is cryotherapy treatment. Authors of a random control trial conducted in the United States found that application of cryoneurolysis, that is, temporary freezing of nerve to block pain, can be an effective treatment option for pain and symptom relief in patients with knee pain due to osteoarthritis. 180 patients participated in this study, with 121 individuals placed in the experimental group and 59 in the control group. Cryoneurolysis was applied to the inferior branch of the saphenous nerve for 30 days while the control group received a sham treatment. Results after 30 days showed significant improvements in the Western Ontario and McMaster University's osteoarthritis index compared to the sham group. Results were effective for at least 150 days after treatment.
In conclusion, staying active and eating healthy is a good strategy to combat OA. If you work in a job where you are seated most of the time, or are a full-time student, then once every hour, get out of your seat and move. It could be a brisk walk around the office, some mini squats, or even a funny dance.
It looks like that gummies just kicked in.
This has been Evidence-Based Projects, with Dixon Cider out on assignment, and alongside Anita Goodpiping, I'm Buster Cheeks out. Good night and good health.
4, 3, 2,